Hello, my name is Kim Bittner, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Quickinar. The ESRD NCC Quickinar events are held in partnership with the Centers for Medicare and Medicaid Services. We are hosting these 30-minute events weekly. They feature patient and professional subject matter experts from around the country, sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted on the NCC COVID Quickinar webpage, usually within 3 business days. Let's take a look at the agenda for today's call. Today we have 2 speakers. First, Natasha Bress from Durham, North Carolina. Natasha is a care partner for her husband, Keith Taylor, who is currently a home hemodialysis patient. They've been married for 8.5 years. Natasha is a licensed real estate broker and property manager and is currently receiving her master's in organizational psychology from the University of Hartford. She admits her biggest accomplishment was finding her husband and realizing that love could be steadfast and true. Also joining us is Renee Bova-Collis. Renee is a patient services director for Quality Insights Renal Network 5 and has 13 years experience in dialysis facilities as a social worker. In her personal life, she was the primary caregiver for both her parents until their deaths from Parkinson's disease and dementia. Currently, she cares for 2 delightful fuzzy kitties with minimal health issues and is a partner to a fairly tolerant spouse who is always crying about something. Today, they will discuss caregiving, meeting the needs of caregivers, and how this is impacted by COVID-19. As our panelists go through their presentation, and if you have questions, please submit them using the chat feature through the WebEx or the Q&A on the lower right of your screen. When we get to the question and answer section of this presentation, we will share the questions we received with our speakers. Our goal is to answer as many questions as time allows. So what is this call all about? You will hear tips from caregivers on coping in a COVID-19 environment. We will share some real-world experiences that you can put to use. We have a few resources for you to use and to share with others. And this is a series of calls that is available to you weekly, offering a variety of topics. So now I'd like to begin the discussion with Natasha Bress. Natasha, thank you for joining us today.
Thank you.
Are you there, Natasha?
Yes.
There you are. Well, welcome to the call. And as a kidney caregiver, how has this COVID-19 environment impacted you?
It has definitely been interesting. I'll be honest and say that my anxiety has definitely been a lot higher, just because, you know, when they talk about the people who are high risk, people with end-stage, you know, renal disease are up there, along with people who have heart conditions, which my husband has both. So I've definitely just been assured of a lot of things and trying to be extra cautious. So sometimes I'm not sure if I'm overreacting or underreacting. It's just an unknown for everyone, and we're just kind of trying to take it moment by moment with everything going on.
Well, thank you for sharing that, and definitely thank you for sharing about some of your feelings, especially with the anxiety, because I'm sure a lot of people can relate to that. What recommendations do you have for healthcare providers to offer support to caregivers, especially if anyone's feeling possibly isolated right now?
Yeah, I'll be honest, my husband's care team at his center, they're really great. They make available to us whenever we have any questions.
I'm sorry, Natasha, we're having a little bit of, you broke up a little bit there. Would you mind repeating that for us?
Yeah, can you hear me?
Yes, we can hear you there.
Hello, can you hear me? Oh.
Yes.
I was just saying that his team at the dialysis center, they're really great, and they've made themselves very available to us with any questions or concerns that we have, even if we're just unsure about his supplies. And that was a big thing when things started happening was, is he still going to be able to supply things like the mask, the gloves, the sanitizer, because that was the short supply, and they were on top of everything and made sure that he still all of his met, and any concerns I had was to answer them and talk me through them. So just being available for your people, your caregivers, and the people on dialysis, just making yourself available, I think it's great. I know they have a lot to go through, so I really am grateful to them for just being so readily there.
Thank you for that. And what do you do to maintain balance between your life and your kidney caregiver life?
We try to make sure that there are times where we're not thinking of, about dialysis or treatment. So we have for us, we have a regular date night that we're just two people that can go on a date and, enjoy each other, and it's not really worrying about treatment. It's usually on the day that he doesn't have treatment that day, so we don't really have to kind of plan around that. And for me, I also try to make sure that I have time alone, whether it's to read or walk my dog, just have some fresh perspective. And then I also have my own therapist that I see once a week that I can kind of have an outside person to talk to about anything that I need, whether it's related to being a caregiver or just me in general.
Okay, thank you for sharing that. Are you hearing from other caregivers about how this environment is impacting them?
I'll be honest, I don't actually have contact with many caregivers, so I honestly am unsure about that. Honestly, before I, became a big part of, this, and I didn't even know about, I guess to me, sometimes caregivers weren't a thing that you really knew about. So I'm going to be honest, I have not heard from any others.
Okay, not a problem there. What recommendations or tips do you have for other kidney caregivers? What would you share with them based off of your experience?
I think just being open and having an open line of communication with your care partner, the person, that you're helping, because a lot of this you're both going through for the first time, and sometimes it can be or seem overwhelming. But I feel like as long as you're able to communicate effectively, I think that really does help. And then just being an active part of groups, being a part of the doctor's appointments, making sure you're there, listening, taking notes, just so that you're well-versed in what's going on as well, so you don't feel like you're not knowledgeable and things like that.
So you that way you can feel a part of the care team as well? Right. Okay. Well, thank you very much, Natasha. We appreciate you sharing your perspective as a caregiver and what you're going through right now in this environment. So thank you for sharing with us on this call today.
No problem. Thank you.
At this time, I'd now like to welcome Renee to the call.
Hello. Thank you for having me.
Absolutely. Renee, with this COVID-19 environment, we've heard from patients that they experience fear going into the facilities. How can caregivers provide support to their loved ones if they're experiencing fear or uncertainty?
Well, I think it's really important for us all to remember that there is a lot we can do to protect ourselves. So there's a lot that we have control over. And in the dialysis setting, precautions is everything. So, and not even just in the dialysis setting, but everywhere that we are right now, whether we're at home or we go to the grocery store or dialysis, you're in the van, whatever, we constantly have to wash our hands. We have to be vigilant about not touching our faces. We need to wear our masks, keep distance from other people, and to remember anytime we remove our gloves or our masks, again, we need to wash our hands. And I think it's also important particularly for folks who have a great deal of anxiety about this, to carry, if they can find them, I know I'm having a hard time with it, but to carry with them like disinfectant wipes and hand sanitizers so that, if they're going to be riding on a van, they can wipe the seat down, wipe handrails, just hold it in your hand, and as you touch things, have that wipe right there, wipe your hands, whatever. But those are all things that we can do to protect ourselves. And I think also, because this is such a frightening time for a lot of people, having people to talk to is very important. So, finding a support group, there are a lot of online resources available. Talk to your social worker about the better ones for the dialysis folks. You can talk to the people that are in the chairs next to you. The social worker and the doctor are good resources for expressing to them the concerns that you have and the difficulties that you're experiencing, and what resources might be available in the community.
Great
but I think it's also important to emphasize that skipping treatment is really not an option. So if people are feeling anxious enough that they're wanting to avoid going to treatment, you really need to have that conversation with your doctor, and maybe home dialysis could be considered as well.
Thank you for adding that in, Renee, about not skipping the treatments. I know that has been brought up before. How can caregivers best support a patient who may not fully understand the potential severity of the environment? What recommendations do you have for the caregiver to help their loved one understand the importance of following their healthcare provider's directions or recommendations for staying safe?
I think of a few different scenarios. So I know with my mom who had dementia, there is a limited capacity for people with dementia to really ever understand what's happening, depending on the severity of it. So if somebody has dementia, farther enough into it that they have an inability really to retain information or to remember from moment to moment, the mask is probably going to be very distressing to them. And so people are going to have to constantly be reminding them to keep the mask on and trying to distract them. It may be necessary for the care partner to sit with the patient to keep them calm and to help with redirecting. One thing that really works for my mom that I always tell people about is they have these baby dolls that have a weight to them. I think they're called therapy dolls, but you can find them online. But they have a real weight to them. And if you put them in the lap of a person who has dementia, it really is a huge distractor to them. And that might also be a way to keep their hands occupied so they're not working that mask. For somebody who has like a cognitive inability that's not dementia, but just has a difficult time understanding concepts, positive reinforcement might help. Providing them with a reward for, keeping their hands washed or, not pulling the mask down. And then sometimes we've got people who just are stubborn and won't take anything seriously. So I think in those situations, with those kinds of folks, it's important for us to share the concerns that we have for their well-being as well as our own, maybe asking them, could you please do this for me? If you won't do it for yourself, do it for me. And also important to keep in contact with staff and let them know the challenges that you're having and ask for assistance from them.
Great. If a patient is using telemedicine for their appointments, what is the recommendation for the caregiver or the care partner for their involvement with that telemedicine visit?
Well, I think with any appointment that we have, it's important to have somebody with you. It's really hard for folks to hear everything when they're in the moment, so it's helpful to have somebody with you to hear that information and help you remember it. A great thing that having the care partner with you is to have them help write things down, to have questions written down ahead of time so that you can bring them up during the call. Also to write down any instructions that are provided, and I think even more importantly to repeat back what you understand to the doctor that you're, or caregiver, or the care professional that you're having the teleconference with. To repeat back to them what you understood them to say, and that gives them an opportunity to correct any misunderstanding that you might have.
Very good. What recommendations do you offer to caregivers to relieve stress?
To relieve stress?
Yeah.
I think joining a support group is a really wonderful thing. Right now, in the environment we're in, the online groups are available. Zoom has like everything on it, but there are some really good support groups that are specifically related to the renal environment. So I would look into that. Your social worker probably has some ideas of ones that you can tap into. Exercise and yoga are great stress relievers. Again, you can do a lot of that stuff through Zoom if you don't already have a regimen in place for yourself. Meditation. I was really pleased to hear Natasha say that she takes time for herself. Me time is very important. I think it's also important to emphasize that you want to ensure that the patient with the renal disease is being as independent as possible in their care, taking as much responsibility as they're able to manage their illness, monitor their medications, do whatever is necessary related to their health. And it's important for all of us to remain active physically and mentally. Keeping that brain occupied is a great way to relieve stress and promote our interests and keep us healthy.
Just to follow up to that one, I mean, you mentioned about Natasha and some of the things that she shared that she does, and talking about the importance of relieving stress. We hear from some of our caregivers that they focus a lot on their loved one, and they're worried about taking the time for themselves. If they are not taking the time for themselves, what would be a good first step so that they could start doing something for themselves and figuring out what it is that they like to do, whether it's yoga or daily walk? I just make a list and just start checking off things, try different things. Go to a support group and ask the question of them, find out what they're doing, see what piques your interest. But I think sometimes just trying different things, you might like it, you might not, but unless you try things, you're not really going to know. But I think the first step is just to take that step, take a first step. Yeah, that's great advice. What is
take a bubble bath? That's great me time.
That is a good suggestion. What is the best approach? You had mentioned a couple times about talking to their loved one's care team. what's the best approach for a caregiver to share any concerns that they might have with their loved one's care team?
Well, I think it's important to acknowledge if you have any frustration or you're feeling overwhelmed, to express that to the healthcare team, because what we don't want to have happen is for you to be so emotional when you go in to talk with the healthcare team that you yell or you accuse, because that's going to fall on deaf ears. People are just going to be very defensive and shields up, and you're less likely to get the help you really are looking for. So to go in and let people know I'm needing help. Even if you can't articulate it, I need help. I'm feeling overwhelmed. I really don't know what it is that I need, but this is the situation and this is how I'm feeling. And just starting that conversation can really help. But the healthcare team is there to help, and I think want to help and want to know what's happening and what your needs are, so that they can make the situation better for you, and because you are the one who is the support for the patient, and that's ultimately the person that the care team is wanting to ensure is in the best place possible. So as a caregiver, it's very vital that that you communicate what your needs are and what you're having difficulties with.
Okay, well, thank you very much for that, Renee. And I'd like to thank both you and Natasha for sharing your own personal perspectives and expertise. And before we begin the question and answer segment, I'd like to quickly go over a few caregiver resources. If we could get the next slide really quick. The first we have is 4 Ways to Empower Yourself to Cope with COVID-19, and it's available on the kidneycovidinfocenter.com website. The other resource was developed by patients and caregivers for caregivers, and it's titled Tips for Kidney Caregivers, and this resource is available at www.esrd.ncc.org/NPFE-LAN. So please take a look at those, and they may be of interest to you and provide resources for you. We'd also like to introduce the kidneyhub.org. It's a secure, mobile-friendly web tool. It was developed with direction from patient volunteers. It has resources for patients and professionals, and it's the place to go to for COVID-19 information, resources about transplantation, home dialysis, infection prevention, and more. The goal of the kidneyhub.org is to help patients and family members make well-informed healthcare decisions. We invite you to check it out today with your mobile device, and then follow the directions to save it to your device's home screen. At this time, we'd now like to open it up for questions and answers, and I'm going to turn it over to Matt, who will let us know all the questions that we've received.
Great, thank you, Kim. And we've received a few questions, but we do have about 7 minutes left in our call, and I just want to take this opportunity to say if you do have a question, please use that chat panel, submit your question to us. We'll try to get through all of what we have and any additional ones that do come in. So, Renee, I'd like to start with you. A question came in, and it is this. How do you explain to a patient or a family member that me time is the time for the caregiver to get rest and recharge so they can continue giving care? It seems like, like it might be a little battle there to get in that frame of mind.
Yeah, and I think folks that are working from home with small children probably feel the same way. How do I let them know that this is my time and they are not to disturb me? If you can't get away, I like taking a walk by yourself. Do you have a room somewhere that you could put a sign up that says, do not disturb, or, it's me time, the rules are, I've got, X number of minutes to myself when the sign is up. I think you just have to kind of communicate to people that this is the new rule in the new world that we live in, and for me to get recharged so that I can be the best that I can be, this is what I need, for however many days. And and I say set aside enough time. Set aside at least a half hour every day if you can for yourself. You have to have a moment to recharge.
The next question that came in is actually for Natasha, but it's right in that same vein. It's this one says, being in quarantine and in close quarters has made me feel like I'm always on as a caregiver, which adds to my anxiety. Natasha, do you have any suggestions on how they can focus on their own well-being without feeling guilty?
Well, I will say I definitely understand that sentiment. I definitely sometimes feel the same way. I think it's really just I give myself a certain amount of time frame, like when I want to just do something by myself. And my husband is pretty self-sufficient, but even though he's self-sufficient, I'm just like on high alert, especially right now with anything. So I kind of just will just take time. It'll just be, we have an office and I'll just go in there and just read.
Okay.
Listen to some meditative music to just refocus myself, because I can't do anything for him if I don't take care of myself. Right.
Yeah. And thank you for that. I got a comment in saying that's a great question and that's a great answer. And like you say, you're not the only person who's felt that, so we appreciate you sharing that. Another question that came in, Renee, I think this one's targeted more towards you. Are there any specific signs of the blues or depression that caregivers should look for in their patients that they care for, or or has there been any sort of increase in what you're seeing there?
Well, I think it's hard for a caregiver who sees this person every single day to really have a good picture of that. So I think if you have any question, you probably need to get it checked out. That's one of the reasons they say healthcare workers should not treat their families, because you have a completely different perspective of what's going on because you're so close to the situation. So if you do suspect anything, you should, I think, seek an evaluation.
Very good. And it actually answers the next question we got, which is should we tell the patient care team if we see signs of frustration or depression or agitation or anxiety? So
absolutely.
All part and parcel there. Great. Thank you for that. Well, I think we're coming up against the end of our event. So Natasha and Renee, thank you so much for taking the time and answering these questions. My comments are coming in that are thanking you for answering those questions so honestly, and we really appreciate that. And thank you for joining us and for your time. If we get any other questions, would you mind if we would send them your way, perhaps, if the need be?
Absolutely.
Yeah,
that'd be fun.
Great. Thank you both. Really appreciate your time today. Thank you so much.
Thank you.
Sure. Thanks, Natasha. All right, we're going to go ahead and get into our wrap-up here. Let's talk a little bit about our next COVID-19 Quickinar events. Our next patient-focused event is 1 week from tonight. That is at 5 p.m. Eastern. And this is a Spanish-focused event about communicating. It's out on our website. All the information out there. One of our patient SMEs from here in Network 7 will be our speaker on that. So we do encourage you to go check out that event and register for it. We would love to see you on that. Our next provider-focused event is tomorrow. It's May 20th, 2020 at 5 p.m., same time as tonight. And that event is still open for registration as well. You can find information on either of those events at our website, which you see on your screen, www.kidneycovidinfocenter.com. And if you click on the upper right corner, you'll see the COVID Quickinar events square. click on that and you can access either of those events and read about them and hopefully register. So that brings us to 5:30 and the end of our event. We just want to thank you for attending. We appreciate your time today. Hopefully you found this event informative. Our contact information is on the screen. If you do need to get in touch with us, you can do so using those resources. Additional COVID resources are available at the CASER website, which you see on the bottom left of your screen. And on the bottom right of your screen is the kidneycovidinfocenter.com website, where you can find the NCC's resources. This event has been recorded and will be archived and published within the next 72 hours, and along with the slides for this event. So we hope to see you on a future event, and thank you for your time this evening, and have a wonderful night.